Hi, I'm Dr. Golden Hartley with Smile Stylist, and we're going to be talking about implants. When do you need an implant? Well, you need an implant if you're missing a tooth or even about to be missing a tooth. Maybe it was from trauma, maybe it's from stepping on a rake, maybe an old sports injury, maybe it's from you had a lot of dentistry done on a tooth and it became brittle, maybe from a root canal and it just broke. Now you have the tooth extracted. What can we do? What's the solution? The solution is an implant. Before implants, what was commonly done was something called a bridge. And essentially what we did is we ground down the front of the tooth, or the tooth that was in front of that missing space, and the tooth behind that missing space. And what we did was we suspended a crown on both of those and put a bridge in between it, or a pontic, or a fake tooth, and just suspended it all together in what we call a 3-unit bridge. And that wasn't super conservative, because what did the tooth in front and behind look like? Did they even need crowns? Oftentimes they didn't. They didn't even have fillings, but we needed to put something there, and that was the only way we could get something attached and solid into your mouth. Well, now we have implants, and implants is just an amazing solution. It's a one-tooth problem, and we want to solve it with a one-tooth solution. So we take an implant, and people often ask, what is an implant? It is a titanium screw that's got some sprayed hydroxyapatite, or kind of like bone on the outside. And so what we do is we place it into your bone, and then we wait a little bit of time, depending on where it is and your bone type, anyway from like 3 to 6 months for it to incorporate or osseointegrate into your body. We actually have cells connecting to it. It is super solid. And so from there we can put a crown on top of it. And so what's cool about this is because before with the bridges you had to kind of floss underneath it and do all these little tricks to try and clean underneath it. And now with an implant you can floss just like normal on the front and the back, and it looks exactly like a tooth, and you don't have those connections. It doesn't look fake. It's just a tooth that looks like it's growing out of your gum tissue. It is super cool.